We're seeing civilians in Gaza paying the highest price of political failure, of war, especially children, especially old people, vulnerable people, who at this stage are beyond exhausted from persistent and continuous rounds of displacement, from hunger, from trauma, and from absolute fear of what comes next. People really are at their wits' end. And that means public health concerns are beyond crisis levels, where children are 40 times more likely to have diarrhea, where there's insufficient space to dig, clean, and appropriate numbers of pit latrines, where, you know, the sounds, the smells, the everyday life are horrific and apocalyptic. People sleep to the sounds of bombing, they sleep to the sounds of drones, they sleep to the sounds of war, as now tanks roll into parts of central Rafah, which is only kilometers away. And they wake to the same sounds. Side too, Rafah is still closed as a border crossing. World Food Programme bakeries in Rafah have all closed down for the lack of fuel and constant supplies being impossible. From the 7th to the 20th of May, not a single WFP truck crossed from the southern corridors from Egypt into Rafah, into indeed the central areas from the southern corridor. And we were unable to have access to our main warehouse for the south because it was in an evacuation zone. And since we have lost that warehouse entirely, including its entire contents of 2,700 tons of food that's either been looted or destroyed because of the fighting around the southeastern areas of Rafah. But we have seen some aid go in, but as I said, that has to turn into a flood of assistance if we're going to ensure we don't start seeing the most acute forms of hunger becoming more common and the most acute forms of malnutrition becoming more common in a community that until the 7th of May was actually starting to look as if we were managing the worst of their needs, if not, but not all of their needs.